to exercise and enjoy their labor laws fully, but limit them to the level that we ensure that their welfare. You see, the police cannot be able to strike. The prison officers cannot be able to strike. They are off the list of
even
people
soldiers.
And the KDF, they can also not strike. So if you can have the doctors and the nurses not being able to go on strike, but they are allowed to agitate for their right to welfare in a certain manner, like the soldiers do, and the police and the prison warden, then we will have actually satisfied the anticipation which is given in the Constitution in attaining highest attainable levels of health care. Because otherwise we'll be speaking from both sides of the mouth. We have our Labor Act, which does not have the health professionals in that list of people who cannot strike. But we have a Constitution which speaks boldly that, and the number one issue is health, attainment of health at the highest level in terms of achieving socio-economic development. Then how do we marry these two? Because the anticipation of the Constitution is big, but the Labor Act and does not seem to pick the same spirit and implement the same. So I think in terms of policy development, that's something we ought to look at, that we can be able to have to exercise fully the right under Article 43.
Indeed, and David, still basing our argument on the framework that my colleagues here have also mentioned in regards to the laws. You know, looking at the universal health care, the trial or the pilot program that was in around 4 counties or 5 counties. 4 counties. It didn't quite work, because if it worked, we could have built on that. But the presidency had a sit down and also came up with the 4 laws that he assented to yesterday: the Facilities Improvement Financing Act, Digital Health Act, Primary Health Care Act, and the Social Health Insurance Fund, which will definitely replace the NHIF. How do we ensure that we do not fall into the same pitfalls that we fell with the universal health coverage in 4 counties? Remember, it's being rolled out in 47 counties.
Yeah. Like I said before, the only thing we lack in Kenya is goodwill. Goodwill, joining what my colleagues here have said, you know, even if we gave the medics everything they ask for today, someone will come up tomorrow and say, no, we forgot to say we wanted to be housed very well. The housing we are being given is not good, so we are going on strike unless you give us good housing. So what we lack is goodwill. We need now to come up with a framework that will ensure that every person that has been given responsibility, right from the community health promoters who are being celebrated today, up to the office of the president himself. Because look at a scenario where I was following what the governor of Nyeri was saying yesterday, that the